Want to lose stubborn pockets of fat and sculpt your body without liposuction? Well, let's talk about Coolsculpting today. This is a non-invasive fat reduction treatment that freezes your fat cells. My name is Dr. Swati Kannan, and I am a cosmetic dermatologist out here in California. For those of us living in the US, well, we just passed Thanksgiving and we're in the holiday season where we tend to gain a bunch of pounds, at least a few pounds. And so it's during this time that I have a lot of requests for body sculpting, which includes Coolsculpting, emsculpting, and other non-invasive methods of fat reduction. You know, as the saying goes, summer bodies are made in the winter. So I really wanted to make a full-length video about Coolsculpting. Now, this is just one form of fat reduction. There are several other devices, but I'm not going to mention them today. I also wanted to make this video because I have this particular YouTube short about Coolsculpting that has gotten a lot, like hundreds and thousands of views. And I get a lot of questions about what is this? How do I get it? So I wanted to be able to make this video to shed light on Coolsculpting. As always, you know, I am not sponsored, so these views are really my own. And I try very hard to be honest and provide accurate information. What exactly is Coolsculpting? So Coolsculpting is a device that is FDA cleared as a non-invasive form of fat reduction. It uses cryolipolysis technology, which just means that it freezes fat. After the fat cells are frozen, they are then eliminated from the body by cells called macrophages. Macrophages are like the garbage disposal cells of your immune system that come gobble up all the frozen fat and takes them away from that treated site. So it is a permanent fat reduction because the fat cells are actually being digested. It is a permanent fat reduction. Now, if you gain weight, you might gain weight back in that area, but it's much harder to do so after getting rid of the fat in the first place. How does this technology only affect the fat cells without injuring the skin on top? So Coolsculpting, it cools the fat tissue, also called adipose tissue, to between 39 and 41 degrees Fahrenheit. Research has shown us that fat cells, they freeze at a higher temperature than the rest of your skin. So when we cool it down to this temperature, only the fat cells get affected while leaving the rest of your tissue unharmed. Once the fat cells are exposed to cold, they then undergo a natural process called apoptosis or cell death, which is then cleaned up by macrophages. Who is a good candidate for Coolsculpting? And this is a really important topic to discuss because not everyone is a good candidate for Coolsculpting. Individuals that are closest to their ideal body weight, and not ideal body weight based on what's in your mind, but ideal body weight based on BMI charts, which I know are a crude measure of health, but individuals that are closest to their ideal body weight who have a few stubborn pockets of fat are good candidates for Coolsculpting. So if you have a lot of weight to lose, you are not a good candidate for Coolsculpting. So Coolsculpting is not a weight loss solution, and it's not suitable for anyone who is overweight. If we look at this patient example, she is already pretty fit. She works out a lot. She has a good diet regimen, but she has a little bit of stubborn fat on her abdomen that she wanted to lose. So after one treatment of Coolsculpting, she got some noticeable results. By the way, if you're finding this video helpful, please hit the subscribe button below and make sure to share it with others who would also find it helpful. How is the treatment done? So you come in on the day of your appointment, we take some photos, obviously. We then mark the area that we want to treat with a template. Once you're marked, we apply this like sticky pad on that area. After that, we apply the Coolsculpting applicator. Once you're positioned and we make sure that the applicator is not going to move, we then start the freezing cycle. Each cycle, at least in the machines that we have in our office, is about 35 minutes. So you're kind of just laying there. You can work, you can talk on the phone, but you're kind of just laying there for about 35 minutes. Now, if you have two areas, so sometimes when we're sculpting the abdomen, we're trying to get the upper abdomen and the lower abdomen. So if you have two areas, that's 70 minutes. Each Coolsculpting device can kind of attach to one applicator. Some offices might have two machines in a room, so you can get both treatments done in 35 minutes. However, we have one device with one applicator. So if we need to do two different areas, it's about 70 minutes. Now, this sounds easy and that anyone can, use Coolsculpting, but proper marking of the patient is really important. I have seen certain issues with Coolsculpting done at other places where the patient has like a step off, meaning that the applicator wasn't placed in the proper position. So when it froze the fat off, it left this like kind of step off. So if, you want to make sure again, that you go to the right in-person cosmetic treatments are still medical treatments and you don't want to sell your face and body to Groupon. Once the applicator is placed, the treatment itself is pretty comfortable and most patients don't really complain about the freezing process. Now, after the treatment is completed, we take the applicator off and you now have like a stick of butter appearance in that treated area, which is basically the frozen fat. We then massage the area for about 2 minutes. So we either use a hand massage or certain devices that help to massage. So we basically massage the area for 2 minutes to kind of loosen up the fat crystals so that they can be more easily absorbed by the body. Now, this massage can sometimes be uncomfortable for certain patients, but I find that most patients can tolerate it pretty well. So would you get this done? Let me know and comment below. How many treatments do you actually need to see results? This answer varies based on the individual and how much fat they have in that area, but for most people, you need multiple treatments, about 2 to 4 treatments that we space about a month apart. On average, each Coolsculpting session results in a 20% reduction of adipose tissue or fat tissue in the treated area. So what can you realistically expect after a Coolsculpting treatment? So most patients report seeing changes as soon as about 3 weeks after the treatment, but the results are delayed because we are waiting for the crystallized fat to be digested and taken away from the treated area. The most dramatic results are apparent about 2 to 3 months after the final treatment. And it's worth mentioning that your body continues to flush out the fat crystals for up to 6 months after your treatments. What are the risks of this procedure? Coolsculpting is generally considered a safe treatment as a form of non-surgical fat reduction. However, some individuals can have certain side effects like redness or swelling or a little bit of soreness or pain in the area after the treatment. Usually these side effects do get better with time. You can also get asymmetry. Like I mentioned before, I have seen some patients with weird shelving, like step-offs after having kind of Coolsculpting done a little improperly. So you can get a little bit of asymmetry. And you may have heard of the Linda Evangelista, the model who came out saying that she had something called paradoxical adipose hyperplasia after Coolsculpting treatment. That means that instead of the fat being reduced, it kind of became bigger. Now, this is a very rare but serious side effect of Coolsculpting devices, but you have to remember that this incidence occurs in about 1 in 20,000 treatments. So it is incredibly rare. I have personally never seen this happen to any of my patients. But if you do get this paradoxical adipose hyperplasia, the treatment of choice at that point is then to get liposuction so that they can suck out the excessive fat that has formed in the area. The other rare risk is something called post-procedural neuralgia. This happens because the sensory nerves, which are the nerves that give you touch and pain sensations, when these are sometimes affected by the treatment, you can have abnormal sensations of pain or tingling in the area. Again, this is pretty rare. I've never seen it happen to any of my patients, but it's something to be mindful of. How much does the treatment cost? The cost is always variable depending on which part of the country you're in, as well as the treatment location and the number of treatments that you need. So the best way to get the cost is to do a consultation with a cosmetic dermatologist. But the cost in general ranges from about $600 to $1,500 a treatment. And again, the cost is also determined on how many areas you need. So if your problem areas like the upper and the lower belly, well, those are considered 2 treatments. And so the cost is, determined based on how many areas you need to treat per treatment. What locations can we treat with Coolsculpting? We can treat any area that has grabbable or pinchable fat. So this includes, your abdomen, your underarms, your love handles, whether they're on your side or on your back. There are also newer applicators that don't have to suck the fat into the applicator itself. It's kind of a flat applicator that we can use on more flatter portions, like for some patients who don't have pinchable fat on their abdomen. But if you have fat which is inside the peritoneum, or which means that it's within the abdominal cavity, that usually presents as a beer belly. Coolsculpting cannot treat this kind of fat. So it can only treat subcutaneous pinchable fat, but not peritoneal or that beer belly type fat. Coolsculpting can also treat the fat underneath the chin, which contributes to the turkey neck appearance. Often though, we have to combine Coolsculpting with other neck treatments because it's not just excessive fat that's causing the turkey neck, but also skin laxity. So check out these 2 videos next, which discuss skin laxity on the neck as well as treatment of skin gels to help define that jawline better. Thank you so much for watching this video. Please make sure to subscribe and I will see you in the next one.